An eating disorder is a disease that causes changes in your everyday life. This includes either eating extremely small amounts of food or overeating. People with eating disorders experience severe disruptions in their normal eating patterns and a significant disturbance in the perception of body, shape, and weight. Eating disorders frequently appear during the teen years or young adulthood, but may also develop during childhood or later in life. The various eating disorders recognized and defined by the DSM-4 include anorexia nervosa and bulimia nervosa.
Eating disorders are culturally influenced disorders with varying prevalence depending on the culture and its social norms. The actual number of individuals with eating disorders is not known because these disorders may exist for a long time before the person seeks help or is brought in for medical treatment.
Eating disorders are almost always comorbid with other psychiatric illnesses. More than 50% of people with anorexia have one other concurrent psychiatric disorder, and almost 95% of people with bulimia have other psychiatric disorders. Anorexia is defined as engaging in self-starvation, intense fear of gaining weight, and having a disturbance in self-evaluation of weight. There are two types of anorexia. They are restrictive and binge eating. Signs and symptoms include fear of weight gain. When the thought of food comes to mind, it preoccupies themselves. Views self of being fat even when emaciated. Cuts food into small bites, pushes food around the plate, develops an intense exercise routine, self-induced vomiting, uses laxatives and diuretics, judges self-worth by weight, and feels powerful or overcome helplessness controls when they eat.
Complications include bradycardia, orthostatic changes in pulse or blood pressure, cardiac murmur, cardiac arrest, prolonged QT intervals, acrocyanosis, hypotension, leukopenia, lymphocytosis, fatigue, weakness, lethargy, osteoporosis, fatty degeneration of liver, amenorrhea, abnormal thyroid functioning, hematuria, proteinuria. Common lab abnormalities: hypokalemia. Dehydration stimulates increased aldosterone production, which leads to sodium and water retention and potassium excretion. Anemia and leukopenia with lymphocytosis. Possible impaired liver function shown by increased enzyme levels. Possible elevated cholesterol. Abnormal thyroid function tests. Elevated creatine levels, which cause skin to appear yellow. Decreased bone density and possible osteoporosis. Abnormal blood glucose levels. ECG changes.
The nursing process.
Assessment.
Nursing diagnosis.
Nursing outcomes.
Planning.
Nursing interventions.
Evaluation.
Binge eating. Binge eating is a branch of anorexia nervosa in which individuals partake in compulsive overeating. The signs and symptoms of binge eating are inability to stop eating or control what you're eating, rapidly eating large amounts of food, eating even when you're full, hiding or stockpiling food to eat later in secret, eating normally around others but gorging when you're done, eating continuously throughout the day with no planned meal times.
Individuals who suffer from binge eating report a history of major depression significantly than more than binge eaters.
Binge eating is a vicious cycle of eating to feel better, feeling even worse, and then turning back to food for relief. Although binge eating may be comforting for a brief moment, when reality sets back in, individuals have feelings of regret and self-loathing.
Unlike bulimia, there are no regular attempts to make up for the binges through vomiting, fasting, or over-exercising. Medical effects include
Patient teaching. Manage stress, eat 3 meals a day and snacks, avoid temptation, exercise, get enough sleep, keep a food diary, and get support.
therapy for binge eating, cognitive behavior therapy, interpersonal psychotherapy,
Medications are not a cure for binge eating, but can be helpful in managing symptoms. Antidepressants and anti-anxiety medications are normally prescribed for binge eating.
A person with bulimia binges on food and then feels guilty. They then use vomiting or laxatives to prevent weight gain. Many with bulimia also have anorexia. The exact cause of bulimia is unknown, but it may be a combination of factors including genetics, psychological, trauma, family, society, and culture. People with bulimia usually eat large, high-calorie meals in private and then feel a lack of control during the episode. Binging often leads to disgust, which leads to purging, which includes vomiting, laxative, diuretic, and enema abuse, and overexercising. Signs and symptoms may include gingivitis, cavities, enamel may be worn due to the acid of vomiting, broken blood vessels in the eyes due to the pressure of vomiting, dry mouth, hypokalemia, dehydration, damage to the esophagus due to acid, and hemorrhoids. Some treatment options include
Nursing interventions may include assessing mood and presence of suicidal thoughts and behaviors, monitoring physiological parameters such as vital signs and electrolyte levels as needed, explore dysfunctional thoughts that maintain the binge-purge cycle, educate the patient that fasting sets up one to binge and the binge-purge cycle and its self-perpetuating nature, monitoring patient during and after meals to prevent throwing away food and or purging, acknowledging the patient's overvalued ideas of body shape and size without minimizing or challenging the patient's perceptions, and encouraging the patient to keep a journal of thoughts and feelings. The following are some assessment guidelines. Antidepressant medication, along with psychotherapy, has been shown to bring about improvement in bulimic symptoms. The use of the SSRI, fluoxetine, in addition to cognitive behavioral treatment, produces a modest gain in the treatment benefit. Fluoxetine treatment reduces the number of binge eating and vomiting episodes in patients with and without comorbid depression. Possible abnormal lab values may include
Low blood pressure,
orthostatic hypotension,
decreased pulse,
decreased temp,
dysrhythmias,
cardiomyopathy,
peripheral edema,
muscle weakness,
constipation,
amenorrhea,
hypokalemia,
hyponatremia,
hypochloremia,
anemia,
increased enzyme levels,
elevated cholesterol,
elevated carotene levels,
and decreased bone density.
So this is our dining room, and what you'll see is posted all around the dining room. We have some of the dining room rules. We ask that you don't bring any bags, backpacks, purses, blankets, jackets into the dining room for obvious reasons. We don't want anyone hiding any food in there.
Did you put anything in it? Or have you been putting anything in it?
I didn't have a 60cc syringe.
Have you been putting anything in it though?
No.
You take all your meds orally?
Yeah, and then, I was drawn to infusions, but not
Okay.
for the past 3 days.
Any suicidal attempts?
No, but very close.
Tell me what very close means.
I'm a nurse, and I've taken some insulin from the hospital. And it took a lot not to just inject myself. And then once I was crushing up my pills to just push through my tube, and I don't know, I just stopped because I was living in my brother's house and I couldn't let my nephew and my brother and my sister-in-law find me, and my mom probably and my twin sister. It's probably the reason why I didn't do it.
You have a twin sister?